Hi, this is Elizabeth Rue from Vanderbilt University, and today I'm going to be talking about social cognition in people with Prader-Willi syndrome. Some of our colleagues in the UK have found that people with PWS could recognize happiness but did worse with negative emotions. They have difficulty recognizing emotion and they also have difficulty reading emotional cues in social context. So they have a twofold problem that makes social communication and also makes socialization much more difficult for them. Some of our other colleagues found that in people with just general developmental disabilities that they have much more kind of social dysfunction that actually could be a downstream effect of executive or behavioral dysfunction. So this idea is that those with depression had a harder time recognizing fear and those with psychosis had a harder time recognizing anger. And so the reality is because of these comorbid diagnoses, it basically leads to kind of a hurt. It's more difficult for people with developmental disabilities and including Prader-Willi syndrome to actually be able to kind of recognize emotion and then be able to do something with them. What we decided to do is we took two different tasks. We actually took the emotion recognition task, which is a series of Ekman faces, and it basically has facial expressions that are universal. So fear, anger, happy, sad, disgust, surprise, contempt. And so what we did is we used this kind of images to show people with Prader-Willi syndrome, and it's standardized. So basically across all cultures, no matter who you are, these are the emotions that basically register with people universally. So what we did is we took these and we actually showed them to people with PWS. And the other thing that we did is we actually had videotape vignettes using child actors in a school setting that depicted negative events with either kind of a mean or a nice response. So it's kind of everyday events that people might see interacting. And I'm actually going to describe some of those in a little bit. And basically, it gives us an idea of social perception. What we had is people watch the video, and they're literally 30 seconds at the most. We would have them kind of clue into a character in the video, and we would say, "What do you think happened?" And they would basically kind of recount the events. And then we would ask a series of questions about those same videos, trying to figure out if people could kind of accurately see what happens and be able to report it, and B, are they able to actually tell how people are feeling, what are they trying to do, and look at things like negative and hostile intentions. And so it gives us an ability to kind of get at those two different aspects of social functioning in people with PWS to see where the deficit lies and then how we can actually kind of speak to it. So the social cognition study that we did at Vanderbilt took a sample of the 350 people that we follow with Prader-Willi syndrome, and we looked specifically at 94 children, teens, and adults with Prader-Willi syndrome. 45.7% were male and 54.3% were female, so it was pretty evenly balanced. And we decided, because there was such a huge age span difference, is that we would basically group them into age groups. So we had our youngest group was age 5 to 10 years. Our other kind of middle childhood teen group was 11 to 19 years. And then we looked at adults in general just to kind of see if they're the same, different, if there is anything developmentally going on. We also looked at things like genetic subtype, gender, age, cognition, and psychiatric diagnoses. And we decided to look specifically at these diagnoses. So attention deficit hyperactivity disorder, oppositional defiant disorder, generalized anxiety disorder, and psychosis. And what we did for those is we actually did a very laborious interview, a psychiatric interview using the kitty SADs, looking specifically at these diagnoses and others, and basically did parent report and then kind of child confirmation to see if the diagnoses actually held. And so what we wanted to do is not just say they had characteristics of these things, but whether they actually met criteria for a diagnosis of that with Prader-Willi syndrome. So then we looked at how do these folks do on recognizing emotions. So fear. In our sample population, only 30 to 60% of kids and adults with Prader-Willi recognize fear over chance levels. So again, if you gave them the idea of how somebody was feeling, they might look at a picture like this where we definitely see that she looks scared, right? And we didn't care whether, they used another word to describe it, but it should actually be a word that's emotion. So if they said clenched or freaked or whatever else, we would ask them to kind of like, oh, well, what do you feel if you're freaked? And so trying to get at the word fear. So we really did help them along. But again, only 30 to 60% of our sample actually recognize fear, even with these really overt pictures. Only 50 to 60% of kids and adults with Prader-Willi recognize sad over chance levels. So again, even though these are very kind of universal emotions and feelings and pictures, obviously, they didn't actually seem to get that people were feeling sad. But anger. Almost 80% of the sample recognized anger. So again, this sounds really familiar with this population. Why are you yelling at me? Why are you mad at me? You're mad at me all the time. I said I didn't do it. Why are you mad at me? But anger seems to be an incredibly salient feature for them. And it is actually probably, when it comes to emotions, the one that people with Prader-Willi syndrome often act on, right? They're often angry about things and irritable. So it was really interesting that this one really seemed to be the one that they recognize most in all of the different emotions. So I'm going to kind of tell you, since I couldn't show the video, it was just too 1990s and grainy. But what we have here is the scenario that we showed them. It's a young girl who is talking to her teacher. She has a big giant stack of papers in her hand, and the teacher says, are you going to be able to carry those papers down the hall without dropping them? Why don't you let me give you a binder clip or something to keep them all together? And the girl goes, oh, no, I'll be really careful. I'll make sure that I get them to wherever they need to go. So she's walking down the hall, and as she's walking, a young girl is at her locker getting her book bag. She gets a couple things out. She slings her book bag over the shoulder, and as she does that, she hits the girl with the papers and drops the papers all over the floor. The girl with the backpack says, uh-oh, I guess I should have watched where I was going. And the girl says, you ruined all my papers. I worked so hard on those. And basically that's where it ends. And so we asked the person with Prader-Willi syndrome, A, what happened? And they walk us through the scenario. And then we say, did the girl with the backpack mean to knock over the girl's papers? People with Prader-Willi said almost universally that yes, she meant to do it. And then we would point out that the girl didn't look. She apologized and also apologized for not looking. And the people with Prader-Willi kept saying, didn't matter. She meant to do it. She was trying to be mean. So it's really interesting that even with this idea of an overt apology, people with Prader-Willi basically looked at the act instead of the intention. The other movie that we watched was a boy who had invited another young man for a movie. So he basically said, at the end of the day, my mom's going to pick us up and we're going to see a movie together. The friend says, I can hardly wait. Then it shows them at the end of the day, both at their lockers, and the young man says to the other, well, when is your mom picking us up? And he goes, oh, she's not picking us up. I forgot that I had a doctor's appointment. And the young boy says, what? You're just telling me now? And the boy says, I told you I forgot. And so the idea was, again, what happened, what was going on, and then what was the intention. And for most people, the idea that you forget something, most people won't hold you accountable for that, right? They wouldn't say, oh, you forgot this thing and now I'm mad at you. But again, people with Prader-Willi syndrome had a really difficult time understanding the idea of forgetting versus the idea of doing something intentionally to actually upset somebody. So it was really interesting to us that even with really overt clues, they weren't able to really see what was going on in the intentions. So what we found is that they did pretty well making correct calls for lying, trickery, deception, or rejection. So if anything was really outright, they were able to kind of make the call there that it was, the person didn't mean to, or the person was being mean. But they really poorly understood that even when sincere accidents happen and people apologize for them, they couldn't get that sometimes things happen that are unintentional. We also found that these things didn't generally improve over time. So there was some improvement over time. But again, it wasn't people who were adults or teens weren't significantly better than those who were young children. So again, what we found out is that they don't get the things that we're seeing in real life. And it also sometimes makes them basically misinterpret the actions of others. So here what we found is they did better in a sincere scenario involving stronger emotional exchange. So the two boys actually got much more angry at each other than the two young girls. So do people with PWS need stronger emotional expressions to correctly interpret social interactions? So this idea is that for a lot of them, they notice things way more when there's a huge kind of emotional expression that goes along with it than they do for things that are kind of low emotion. So we were really interested in this idea of, what exactly is going on and how does it affect their social ability and social communication style with other people. So what we found is that people need to actually have meaningful relationships. If they're going to have meaningful relationships, it requires reading the intentions of others and responding accordingly. So because people with PWS have a pretty limited repertoire of emotions, so basically they often talked about being either happy or mad, they don't have the full range of emotions. And because they don't, it basically means that they sometimes mislabel an emotion as mad when it really is sad or upset or disappointed or anything else. And so for us, we've had a lot of clinical experience, actually almost 25 years in people with Prader-Willi syndrome. And what we find is that they often basically kind of like binary kind of pick. They're either happy or they're mad. And so they really don't have this idea of the full range of emotions. And if they don't recognize them, it's really hard to actually express them in an appropriate way. But we need to actually be able to kind of teach these things, because if you can understand your emotions, then you can start to understand other people's emotions. So the other things that came out is when we looked at those psychiatric diagnoses, there was like kind of another level. So those with psychosis had a harder time recognizing fear, and those with ADHD had a harder time understanding subtle cues. And so, kind of like the picture says, there's not always going to be a signpost to tell you what to focus on or what to look at. So the idea is that what we need to do is try to help them focus their attention on things that are important to the important information to the social scenario, so that they can respond appropriately. But what it also tells us is there's definitely underlying psychiatric disorders, and they were a bigger predictor of social dysfunction than genetic subtype or age in PWS, which really surprised us, and I'm sure surprises a lot of people. But it's a little bit like trying to ride a unicycle, and then somebody throws you a basketball and says, hey, see if you can make a basket. People with PWS are already struggling with something so significant that it really impairs their social judgment and their social kind of responsivity to other people. So it's this idea that what we need to do, if we think about interventions, is maybe deal with some of these psychiatric issues first before we really focus on social interventions, because you can't take advantage of it if you're riding a unicycle. So we need to really get them, in a place where they're stable, so that we can actually kind of work on these social skills in a setting that actually is going to make a difference there. So what we also found is that there's this idea that the lens may make it harder for people with PWS to see things clearly. So we're trying to help them learn to focus attention, use voice and body cues to enhance communication, learn to slow down and soothe themselves before responding, and then take in all the information before jumping to conclusions. The idea is you don't always have to respond negatively to situations, but people with PWS are kind of primed for that, right? They're primed to be much more negative and to attribute negative intentions to other people. So knowing that their lens is distorted can help us make things clearer. And then knowing that having better social skills can actually combat loneliness and ease anxiety and depression. What we find is that people with PWS tell us a lot that they're lonely and they want more friends and they want to be able to connect with others. So what we need to do is think about kind of combating some of those psychiatric features and really focusing on teaching the skills that they need to actually interact better, have friendships, which is going to ease loneliness, ease anxiety, and ease depression. And given the fact that everything is virtual, we actually have a social skills curriculum that is completely done virtually. We actually did it several years ago through FPWR's awesome funding. And it really, we're going to talk a little bit more later in the parent session about how we found that the BOSS study actually did help ease that social isolation and really help people connect with PWS. And again, I want to thank all of our families who participate in our studies because we could not do it without you. Thank you so much.